My name is Mark LeDoux. I'm an interventional pain specialist here in DFW area. I'm double boarded in anesthesiology as well as interventional pain management by the American Board of Anesthesiology. I went to undergrad at Lamar University in Beaumont. I was an athlete there. Grew up a short distance from there, so got recruited pretty quickly to run there. And then I went to medical school, UT school in San Antonio, the Health Science Center there. And then I continued on to do my postgrad at University of Texas Southwestern in Dallas here. I did my anesthesiology training there, and then I did my fellowship training there as well. I always knew I was attracted to the health field. I always wanted to do something that involved helping people. I was driven towards, the fitness side, the rehab side, the recovery side. Despite being injured at a young age, I continued to run through college. It was actually my worst year was the year I got injured, but that was my freshman year. And then I became internationally ranked and did, really well. Competed in the NCAA championships, and even as recent as 2013, I was the world champion in the 400-meter hurdles for masters track and field. So despite having an injury and having to deal with that, very, very frequently throughout the year, depending on level of training, you can do it. So I have a hard time telling my patients, no, you can't play a sport, or no, you can't ever be active, or you can't, live a healthy, fun life. So my company that I am a partner in is Interventional Spine and Pain. So from a pain management standpoint, we treat just about every type of pain there is. Everything from headaches to neuropathic pain, burning pain, back pain, spine pain, rheumatologic disorders. We see every pain disorder there is, trigeminal neuralgia. There's not anything that we aren't comfortable treating. When our patients come in for their first consultation, we do a complete physical exam. We discuss everything that could be bothering them, from headaches to a very focused complaint that they may have of specific low back pain or radiating pain into their leg. We typically will start with some level of medication. We involve lower intensity physical therapy, and we'll work into a regimen that helps them get back on their feet. We often encourage an interventional type treatment because it reduces the amount of narcotics that they're going to be dependent on. A lot of patients come to us already on those, so we have a little bit of a hill to overcome, but oftentimes we can get those pain medications down. Standards of medicine are an absolute necessity. I think there are a lot of areas of medicine that there aren't the certain standards that should be in place in regards to fellowship training, residency training, your board exams, your continuing education. I think there's a lot of gaps in certain specialties, and pain management is one of those. So specific to pain management, standards are key. You must have them in order to create a safe experience for a patient and a place where they feel 100% comfortable that the quality of care they receive is going to be adequate. Being a top 10 MD is important to me because it proves that I've met a certain standard, that all the doctors in that group have met a certain standard, whether it's per their board exams, per their residency and fellowship training, but also from their peers, surrounding hospitals, surrounding patients, that you are represented by your community to be an outstanding provider.